The crushing weight of cuts. How benefit changes will devastate disabled lives in the UK. The UK government's impending changes to disability and incapacity benefits are poised to inflict a devastating blow on hundreds of thousands of vulnerable individuals, plunging them deeper into poverty and jeopardizing their access to essential care. A chilling report from Policy and Practice paints a stark picture of the impending crisis, revealing the profound human cost behind these controversial reforms. The sheer scale of the impact is staggering. Policy and Practice estimates that over 230,000 disabled people will lose access to Personal Independence Payment, PIP, and the incapacity element of universal credit, resulting in an average annual loss of at least £8,100 per individual. This translates to a collective financial hemorrhage, depriving these individuals of vital resources necessary for their well-being and survival. But the crisis extends far beyond these figures. Nearly 600,000 more individuals who don't currently claim universal credit will also lose eligibility for PIP, facing a similar bleak future. The overall picture is even more alarming. More than 3 million UK households, a staggering number, will be directly affected by these benefit cuts starting next year. For many, the annual financial loss will reach a crippling £10,000, a sum that represents far more than mere monetary value. It represents access to food, housing, healthcare, and essential support services. The implications for these families are catastrophic. Official government forecasts predict a horrifying consequence. 250,000 individuals, including 50,000 children, will be pushed into poverty due to these changes. This represents a callous disregard for human dignity and a stark failure of the social safety net. These aren't just numbers on a spreadsheet. These are real people, with families, dreams, and hopes, now facing a future shrouded in uncertainty and hardship. The government justifies these drastic measures by claiming they are essential to overhaul a broken benefit system, arguing that the reforms will encourage work and skills development among ill and disabled individuals. However, this justification rings hollow in the face of the overwhelming evidence of the devastating consequences. Critics argue that these cuts are nothing more than crude budget savings, disproportionately targeting the most vulnerable members of society. The Labour chair of the House of Commons Work and Pensions Select Committee, Debbie Abrahams, has voiced strong concerns, stating that the cuts risk exacerbating ill health amongst the UK's poorest households and further isolating disabled people from the job market. This isn't just about economics, it's about public health and social justice. By pushing individuals into poverty and depriving them of essential support, the government is actively undermining their health and their potential to participate fully in society. The irony is palpable. A system designed to support those in need is being dismantled, potentially creating a greater burden on the NHS and other public services in the long run. The Commons Work and Pensions Committee is taking the matter seriously. They will summon Department for Work and Pensions ministers to provide evidence during a mini-inquiry focused on the impact of these changes on claimants' health, employment prospects, and poverty levels. This inquiry is a crucial step towards uncovering the full truth behind these cuts and holding the government accountable for its actions. The coming weeks will be critical in determining the future of this vital social safety net and the lives of millions of disabled people across the UK. The silence surrounding this impending crisis must be broken. The voices of those affected must be heard, and their concerns must be addressed. This isn't simply about economic policy. It's about human decency and the fundamental right to a dignified life. The government's claim of reforming a broken system falls flat when the system itself is actively dismantling the lives of the most vulnerable members of society. The long-term consequences of these cuts will be far-reaching and deeply damaging, creating a legacy of hardship and inequality for generations to come. We must demand better. We must demand action. The time for silence is over.